Hey everyone, it's Argonath here from The Right Way. Got a very important article for those of us living in New Zealand, in that we don't know what is the true number of our ICU bed capacity in New Zealand because the government has not been giving us the full story. In fact, I think they've been misrepresenting the truth. This is supposed to be the most transparent government ever. When they came into power, that's what their slogan was. And in fact, they have been the least transparent government ever. So Tracy Watkins at the Stuff website has a really good article on this. Let's have a read with this. So first thing to talk about is the Super Saturday Vaxathon. It took Sir John Key, previous Prime Minister of New Zealand, to give them some ideas about how they could try and get the vaccination rates up. So it's good that the Labour government took John Key's idea and went with it. So at least they're doing something, but it took someone else to give them some ideas about what it is they actually need to do. So after last week's editorial, I heard from a senior hospital clinician who admitted that they were shitting themselves over the modelling that showed the pressure that was about to come on the health system, because New Zealand just cannot stay locked down in the strictest restrictions forever. Currently, much of the country is in level 3 lockdown because that's where cases in the community are. Other places in New Zealand are kind of in a mixture of level 2, level 3. So we're just not in a state where we can get out. But even in level 4, the cases were still bubbling along. So it shows us that our strictest lockdown conditions, it still wasn't containing the virus. So at some point, it's going to take off and we're going to have to deal with it. He is not alone. When Health Minister Andrew Little claimed ICU beds had increased by more than 100 in the 15 months since COVID, Wellington ICU specialist Paul Young did a very unusual thing. He went on the public record to call bullshit on the minister's numbers. I challenge you to visit any ICU in the country and find one clinician, just one, who can show their newly staffed beds, Young tweeted. You can either believe the minister or you can believe the people who are working at the coalface. This is Tracy Watkins saying this. I know who I believe. And yep, I believe that as well. So it would be very easy for the Health Minister Andrew Little to disprove that. Just go into a hospital, find a ICU clinician and get them to show them one newly staffed bed. It should be pretty easy to do, right? But I bet you they don't, because they sat on their ass for about 15 months when we didn't have any COVID in the community, worrying about other things like a cycling bridge over the Waitemata Harbour in Auckland, which would have cost $750 million, $750 million, when that money could have been spent on health. Luckily they canned it because they saw how much people were against it, and it was a complete waste of money, but they still wasted about 50 million to get to the point of actually doing initial designs, and I don't know what they spent it on, but anyway, until they got to the stage of cancelling it. So they wasted $50 million on the stupid cycling bridge, which people could have told them at the very start was not going to be good. The truth is, there's been almost impossible to penetrate the spin surrounding ICU capacity for months now. So Tracy is saying this: I first started asking in the middle of a winter when an RSV outbreak put hospitals under severe strain. So we had an RSV kind of flu virus outbreak, and basically a lot of people started going into hospital because of that, and it put, just because of this RSV outbreak, not COVID, it put a severe strain on our ICU capacity at that point, right? So it just goes to show you that even with COVID, we're not really set up. I was following up on an April 2020 press release on the Ministry of Health website that said ICU capacity was supposed to have been urgently tripled to 550 by July that year. So that was in 2020, so July 2020. They should have had 550 ICU bed capacity. Yet in July 2021, when I first approached the Ministry of Health for an update on progress towards these 550 beds, they queried it as a number that they didn't recognise as coming from the ministry. It was apparently on their own website. They didn't know about it. God, how bloody useless are these officials? When I pointed out that it was on their website, they responded that the figure of 552 was an indication of what additional ICU capacity could be bought online should it be needed. They didn't have say it's ready to go. It could be bought online. It could be brought online, right? Not that it will be, not that it can be, it could be. So these officials are absolutely useless. This government is absolutely useless as well. They added that there were currently 284 ICU beds. This seems to suggest a drop of around 60 beds on the previous. Oh my God, that's less than what we had the previous year. What the hell is going on? But that figure of 284 is different again from the one that Little quoted on Radio New Zealand last week of 340. So even the health minister can't get his numbers correct based on what was given by the Ministry of Health. Yet, according to an audit by the Australian New Zealand Intensive Care Society released just last week, here we go. None of these numbers are correct. The actual figure is just over 172 fully staffed adult ICU beds and 14 fully staffed paediatric beds, a total of 186. So what was the number they had before? So the Ministry of Health said 284 and the Minister of Health said 340, but we actually only have 186. That is absolutely pathetic. How can there be such a huge discrepancy between the minister's claims and what the experts are saying? The Society points out that the numbers can fluctuate widely depending on staffing, while some district health boards conflate staffed ICU, high dependency and coronary care beds. In a worst case scenario, there are fully equipped ICU capable beds up to 500 with crisis staffing models, but crisis staffing models can be relied on only for short bursts of time, not for the reality of yearly COVID outbreaks. Right? We just don't have the capacity to be able to do it week from week from week from week. There is also a big difference between a number of fully staffed and fully funded beds. Yes, fully funded doesn't mean anything. Fully funded means we can fund you for a bed, but if you don't have staffed people to look after that bed, then that bed is absolutely useless, right? The Society notes it is currently unable to open around 20 ICU beds because of staff shortages. Anecdotally, the staffing situation is getting worse, not better, as nurses leave for more lucrative positions in Australian hospitals and private nursing jobs in the UK. With Australia racing to remove travel restrictions, the fear is that could turn into an exodus. We need to pay our ICU nurses more, pay our ICU doctors more. We're going to need these people. We absolutely have to have these people. Government, pay these people more, right? Whatever it takes, pay them more. I'm quite happy for my tax money to go to them. None of this should be news to the minister, however. These are numbers Andrew Little should have known by heart. They are numbers he should have been asking for every week, and he should have been moving heaven and earth to make sure our hospitals were better prepared for the outbreak we all knew was coming. It's inexplicable that he didn't. The tragedy would be if someone has to pay for the price of that failure. So again, just goes to show this is a completely inept Labour government, because they all come from academic backgrounds and stuff. They don't have any business acumen. They've never been out in business. Well, I guess the Prime Minister worked in a fish and chip shop, so that's better than nothing. But they cannot run anything, right? They're just hopeless at it. Anyway, what do you think? Do you think we have enough ICU bed capacity? Do you think we need more? Do you think we should be paying our nurses more money? I certainly do. Let me know in the comment section. I'd love to hear. And if you like this video, give it a thumbs up. If you don't like the video, you're welcome to give it a thumbs down. And if you like my content, then please subscribe. It just helps my videos to get noticed by the YouTube algorithm. Anyway, hopefully I will catch you in the next video.